like when I was doing residency, I moonlighted, which moonlighting means I did my regular work hours, which weren't 80 hours a week, but likely more. And then on the weekends, I used to drive from Long Island to Philadelphia to work extra shifts. I was it was surgical specialties, usually watching over ICU, some cardiac ICUs.
This was in fellowship, though.
In fellowship,
so you finished residency.
Yeah.
This was in fellowship.
In fellowship.
Because you can get your residency into troubles.
Yeah.
Who cares?
Who cares? I did like first assisting. A lot of it was just sitting in a room and just watching TV pretty much.
Yeah. Overnight in-house calls.
Yeah. In-house calls. And, I got paid pretty well. I saved all that money. I took a few trips, but saved all that money to
you didn't really take many
start my practice. Once I started practice, I shared an office with one of my mentors throughout my years, and he passed away within that first 6 months. And the problem was, like figuring out what you're going to do, trying cosmetics or doing reconstruction and taking ER call and everything. At the time, it was easiest to take ER call. Right now, I would probably not tell many people to take it. Although with the stipend, you could probably function and start a practice. It's just if you're taking too much of that call, then you don't have the availability, and you might burn yourself out and just taking care of patients. I've also heard of
the starting rates going for like just private plastic surgeons, new grads. Like sounds like garbage. Like can supplement it with some stipends for taking trauma calls, but some of these contracts you give up that stipend. I
had my friends that I would be moonlighting and they still continue to moonlight when they were in practice.
Yeah.
Because it paid better than some of the contracts they had.
Yeah, you got to ask about the numbers and like make sure the numbers make sense.
Yeah, especially if you're not flexible in where you want to live, you want to work for someone, it's going to be, it's going to be tough. So if you're more flexible, there's some areas of the country paying plastic surgeons pretty well, but like coming back to where you want, like for me, I didn't even interview. I was like, I'm going to do this on my own. But like, I know some people were interviewing and I'm like, I could have made more money being a general surgeon out there in Arizona than adding another 3 years without getting paid much.
The main factor I will say I've seen repeated people make less money than they should make is when they've had geographical restrictions. They're like, I can only live here. So you get limited to your job opportunities. Not saying you got to go live in like bumfuck nowhere.
Yeah.
But there's opportunities if you're willing to go to different areas of the country. It's like, oh, okay. That's an extra $200,000 a year to start off for like your first 2 years. Yeah. It just means you're going to make more after those first 2 years.